So today we will be talking about odontogenic tumors. So odontogenic tumors are derived from epithelial and or mesenchymal remnants of the tooth-forming apparatus. Therefore, they are found exclusively in the mandible and maxilla and occasionally on the gingiva. So the first are the epithelial tumors. So historically, the first is ameloblastoma. Historically, it has been recognized for over a century and a half. Its frequency, persistent local growth, and ability to produce marked deformity before leading to serious debilitation probably account for its early recognition. Next is the calcifying epithelial odontogenic tumor or the Pinborg tumor. It is a benign tumor of odontogenic origin that shares many clinical features with ameloblastoma. Microscopically, there is no resemblance to ameloblastoma and radiographically distinct differences will be noted often. So, adenomatoid odontogenic tumor is formerly termed ameloblastoma because it was believed to be a subtype of ameloblastoma that contains duct-like or gland-like structures. Clinically, microscopically, and behaviorally, it is clearly different from ameloblastoma. So, squamous odontogenic tumor, the lesion is believed to be derived from the neoplastic transformation of the rest of malaces. It occurs in the mandible and maxilla with equal frequency, favoring the anterior region of the maxilla and the posterior region of the mandible. The age range of this tumor extends from the second through seventh decades and a mean age of 40 years. They have invasive capacity and infrequently recur after conservative therapy. So the next is a clear cell odontogenic tumor carcinoma. It is a rare neoplasm of the mandible and maxilla. The origin is unknown, but the location and histologic appearance of this lesion suggests an odontogenic source. It is a locally aggressive, poorly circumscribed neoplasm composed of sheets of cells of relatively clear cytoplasm. To the mesenchymal tumors, odontogenic myxoma, a benign mesenchymal lesion that mimics microscopically the dental pulp or follicular connective tissue, a relatively common odontogenic tumor. So next is the central odontogenic fibroma, a rare ectomesenchymal tumor that is regarded as the central counterpart to peripheral odontogenic fibroma, found in mandible and maxilla in all age groups with a 2-1 female predilection. Cementoblastoma, benign fibro-osseous cementum jaw lesion. Young adults have them in the mandible rather than in maxilla. They are attached to and replaces tooth root. Periodontal ligament space surrounds lesion, opaque mass, and may rarely cause cortical expansion. They have no recurrence. So periapical cemento-osseous dysplasia represents a reactive or dysplastic process rather than a neoplastic one. Appears to be unusual response of periapical bone and cementum to some undetermined local factor. When not associated with tooth apex, focal cemento-osseous dysplasia is used. So the mixed tumors, the epithelial and mesenchymal, both of these characteristics are in these tumors. So ameloblastic fibroma and ameloblastic fibroadontoma are considered together because they appear to have slight variations to the same benign neoplastic process. Both are benign mixed odontogenic tumors composed of neoplastic epithelium and mesenchyme with microscopically identical soft tissue components. So odontoma, most common odontogenic tumor, regarded as the hamartoma rather than a neoplasm. They may appear as numerous miniature rudimentary teeth, in which case they are known as compound odontomas. So the next is the benign non-odontogenic tumors. The first is the ossifying fibroma, a benign neoplasm of bone that has the potential for excessive bone growth, bone destruction, and recurrence, composed of a fibrous connective tissue stroma in which new bone is formed. It is classified as one of the benign fibro-osseous lesions of the jaws. Next is the fibrous dysplasia, a condition in which neuromedullary bone is replaced by abnormal fibrous connective tissue proliferation in which new non-maturing bone is formed. So, osteoid osteona is an uncommon primary lesion of the bone that occasionally arises in the maxilla or the mandible. It is thought to represent a smaller version of the same tumor, although some prefer to separate these lesions into two distinct entities. Cemento-osseous dysplasia refers to a disease process of the jaws for which the precise cause is unknown. Describes a spectrum of disorders that include a periambical cemento-osseous dysplasia and florid cemento-osseous dysplasia. So plastic fibroma, a benign locally aggressive lesion of bone that can be considered the bony counterpart of fibromatosis. Usually appears in long bones and pelvis but occasionally may affect the jaws. The cause of these is unknown. Next is the chondroma, a benign cartilaginous tumor of unknown cause, rarely seen in the jaws, especially in comparison with their recurrence in the other skeletal sites. Commonly appears as painless, slowly progressive swelling. So this central giant cell granuloma, a benign proliferation of fibroblasts and multinucleated giant cells that occurs almost exclusively within the jaws. The tumor typically presents as a solitary radiolucent lesion of the mandible or maxilla. The giant cell tumor are true neoplasms that arise most commonly in long bones. They exhibit a wide spectrum of biological behavior from benign to malignant. They are rare but is characterized by the presence of numerous multinucleated giant cells. So, hemangioma of bone, rare intraosseous vascular malformations that when seen in the jaws can mimic both odontogenic and non-odontogenic lesions. Langerhans cell disease, they are formally known as histiocytosis X and idiopathic histiocytosis. It is a disorder characterized by a proliferation of cells exhibiting a phenotypic characteristic of Langerhans cells. The tori and exostosis are nodular protuberances of mature bone. Their precise designation depends on the anatomic location. They are non-neoplastic and rarely a source of discomfort. So coronoid hyperplasia of the coronoid processes of the mandible is an uncommon condition that is often associated with limited mandibular motion. That would be all. Thank you.